Hello, my name is Ahmed Şinar. I am an obstetrician and gynecologist. I work for Bağcılar Şafak Hospital and for Zain Group. I am especially interested in high-risk pregnancies and in vitro fertilization and assisted reproductive techniques. Now I will answer the most suspected questions about IVF. IVF is the abbreviation for in vitro fertilization. We use it in vitro fertilization and macro injection together nowadays. It means we will take the oocytes from the woman by transvaginal route and take the sperm from the man and make the micro injections and form the embryos in the laboratory environment, then wait for 5 days for the growth of the embryos, then transfer them to the woman for a healthy pregnancy. The patients must consult to the physician after 1 year of normal periodical sexual intercourse without contraception. But it's only suitable for the normal couples. If the couple, woman or man, has a known disease before the marriage, or if the woman has irregular menstrual bleedings, heavy menstrual bleedings, or endometriosis, or any infection or surgical operation from the pelvic organs, then they must not wait for 1 year to be completed and consult the patient immediately. The most suitable candidates are for the woman with irregular menstrual bleedings, for tubal obstruction due to the pelvic surgeries or infections, and for the man who has low sperm quality, especially the number of the sperms or the motility and the morphology of the sperms. IVF procedure is not painful. From the beginning of the menstrual bleeding till to the collection of the eggs, with very fine needles, micro-injections is made to the woman, which is not painful. The oocyte collection procedure is somehow painful, but it's done under general anesthesia, so the patient does not feel it. The transfer of the embryos and the rest of the days are not painful. The success rate in IVF is nearly 70% in ideal patients, which is young, healthy, and no other existing diseases. But as the age of the woman and man increases, existing diseases is added to the condition, the success rate will eventually decrease, unfortunately. The eggs, embryos, and the sperm are stored in the IVF laboratory in cryopreservation tanks. Time interval for the storage of both sperm, eggs, and the embryos are infinite. In the first days of IVF procedures, lots of embryos were transferred, so multiple pregnancies, twins, sometimes triple and quadruple pregnancies occurred. But now, for the health of the woman and for the law enforcements, only 2 embryos are transferred. But for a normal couple having a baby, if we compare, twin pregnancies are a little bit increased. After the transfer of the embryos, the patient must have a physically limited life. Heavy exercise, swimming, sexual activity must be delayed till the pregnancy tests. The drugs are similar to the natural or laboratory produced sexual hormones the woman produces in every cycle. But the hormone dosage is increased in order to get multiple oocytes at every cycle. Frozen egg transfer is more successful than fresh egg transfer, but especially sometimes the health tourism and the patient's accommodation restrictions and the economical reasons force us for fresh transfer. After the transfer of the embryos, we said before, there are few physical activities to be avoided. But besides them, the patient can continue her normal life.